Today is Emergency Nurses Day. HCA Healthcare tells us that they saw more than 9 million emergency room visits in 2024. So here to talk about this, we have Morgan Jared, ER nurse and director of the ER at HCA Healthcare Swedish. Good morning.
Good morning. How are you?
I'm so well. Thank you so much for being here.
It is an honor to be here with you and all others.
Tell us a little bit about how you got into nursing. We were talking a little bit in the commercial break. I love the backstory here.
Yeah, so my mother's a nurse. She's a nurse for 25 years. I was probably 5 or 6 when she started her career, and I remember her working as a waitress at Applebee's and going through nursing school and just the discipline that took and then the care she was able to give others. It inspired me without a doubt. So whenever it was time for me to choose my profession in life, I figured why not go be a nurse and make a difference every day.
Yeah, and that is definitely something that you're doing. Thank you so much for all that you do each and every day. Let's talk a little bit about ER visits. Are you guys seeing a rise in these recently? What's going on?
Yeah, I would say over the past 2 to 3 weeks, we've seen a pretty significant increase in our volume. You know, we're going into the winter months, and those typically have illness associated with them, you know, fever, flu, all of those things. We're always here for our community at all 3 of our locations, and HCA Health One in general with such a big footprint here in Denver. We see a lot of volume and a lot of people, so it's an honor.
Yeah, Morgan, how does that impact the staff? I mean, you know, you're trying to take care of all of these people, but what impact does that have on you guys?
Yeah, you know, we do a really good job of being proactive and making sure that we have the right people in the right place to take care of patients when they arrive. There's undoubtedly a burden that comes with the increased volume, but we handle it with a smile on our face, and we make sure that we work through our processes to make sure quality's there.
Yeah, definitely. What do you think the increase is that we're seeing right now? Do you think it's just because of the time of year, or what do you think that is?
Yeah, coming off the summer months, we typically see a seasonal change. So time of year, illness, especially as things cool off and people come closer together, we'll see fever, flu, those types of things. And then just general chronic illness is always an impact to our volume.
Let's talk a little bit more about Emergency Nurses Day. Every day should be Emergency Nurses Day, but how does it make you feel today, just knowing that there's a day dedicated to everything that you guys do day in, day out?
You know, emergency nurses are a special breed. It takes a special kind of person to deal with it. Everyone who comes to the hospital has to come through the ER for the most part. And so an ER nurse has a unique capacity to touch the lives of, you know, tens, if not 20s of people every day and be there when they're their most vulnerable and when they're having their worst day. So it's an honor to be an ER nurse. That's why I got into ER nursing to begin with. And I know that my team takes pride in that. So to be able to celebrate them and elevate them as an ER nurse is a lot of fun. We've had a lot of fun this week so far.
And you have been in ER your whole career.
I have, so going on 10 years. I've worked at 7 different healthcare systems across the country. This is by far the best of any that I've ever worked in. And it's really fun and interesting to get to see how ER nursing is across the entire country.
How would you describe ER nursing? I would have to imagine that it's so rewarding, right? Maybe a little bit chaotic as well. Give me some words that you would use to describe it.
Yeah, so the ER nurse and the ER in general is where we triage patients to get them to the right place, right? Do they need to go to the cancer floor? Do they need to go to the trauma floor? Do they need to be in our ICU? And so you see everything, right? You got to be the jack of all trades and hopefully the master of most, which is a ton of fun to be able to develop your skill set as a professional. ER nurses have that hunger, they have that drive. They want to be the best at what they do. There's always healthy competition between us and our other nursing professions.
Sure.
I'd like to say that we're the best. But being an ER nurse is a point of pride for anybody who can claim that title.
Well, Morgan, thank you so much for everything that you do every single day, not just today. We really appreciate you. You rock, Morgan.
Thank you so much, and thank you on behalf of all ER nurses.
Yeah, you bet. Thanks so much.